Hello, my name is Jocelyn Diaz. I am an RN to BSN nursing student at SPC College of Nursing. Today I will be presenting a literature review on effective hand hygiene practices. This presentation evaluates recent quantitative research to determine how we can move beyond basic education towards sustainable clinical compliance. Hand hygiene is the cornerstone of patient safety. The significance to nursing practice is that hand hygiene is the single most effective way to prevent healthcare-associated infections, or HAIs, as per World Health Organization, WHO, 2009. Although we know the importance in prevention, global compliance rates remain alarmingly inconsistent. The purpose of this review is to answer the questions: which specific interventions, ranging from high-tech virtual reality to automated feedback, actually leads to measurable improvement in nursing practice? The problem isn't a lack of knowledge. It is a knowledge-practice gap. Current literature suggests that traditional sink-side posters are no longer enough. As we face more complex pathogens, we need evidence-based strategies that address the behavioral and environmental barriers nurses face during high-stress shifts. The practice needed is to reduce infection rates and patient morbidity through sustainable evidence-based hygiene habits. The knowledge gap would be to identify which specific training method is best. To conduct this review, I searched databases including PubMed, a free database maintained by the National Library of Medicine, CINAHL, or Cumulative Index to Nursing and Allied Health Literature, and JMIR, or Journal of Medical Internet Research. Here I looked for peer-reviewed primary quantitative studies published within the last 5 years. I narrowed the search to focus on 3 distinct research designs: descriptive, quasi-experimental, and experimental, ensuring a high level of evidence for each selection. 3 studies were selected for the review and 2 additional for expert summaries. Article 1 by Lutanova et al. Is a level 4 descriptive study. It found that 79.9% compliance rate among nurses with years of experience being a major predictor of success. Specifically, that being over 45 years of age and have more than 20 years of experience were associated with high compliance rate. However, because it relied on self-reporting, we must consider the risk of actual clinical lapses. Nurses may perform better when they know they are being watched or surveyed. Next, we looked at Mira et al., a level 3 quasi-experimental study on virtual reality. The results were dramatic. Hand hygiene accuracy jumped from 26.6% to nearly 97.9% post-VR intervention. This suggests that immersive gamified training is far more effective for skill acquisition than traditional methods, though we still need to study how long these skills are retained over time. Article 3 by Iverson et al. Provides level 2 evidence from a cluster randomized trial. Interestingly, they found that sending weekly automated feedback emails had 0 impact on compliance. This is a crucial finding. It tells us that passive feedback is easily ignored in busy nursing homes or hospital environment. There is high baseline compliance in day shift at 57% versus significant drops in night shift at 38%. To support these findings, a 2023 systematic review and meta-analysis confirmed that intelligent technology, like the use of electronic monitoring that provide real-time prompts, can increase compliance by 56%. This reinforces the idea that technology must be active rather than passive to be effective in reducing infection rates. The impact of this type of use was a 75% reduction in the infection rates. My final supporting source is a meta-synthesis that identifies social modeling as a key factor. Essentially, if a nurse sees a senior clinician skip hand hygiene, they are more likely to do the same. This highlights that hand hygiene is a cultural issue as much as a technical one. That time and pressure forces us to take shortcuts, and if leaders don't wash, staff won't either. When we synthesize these 5 sources, a clear picture emerges. Virtual reality is excellent for teaching the skill, but social modeling and workload barriers identified in the qualitative data explain why passive systems, like the emails in the randomized control trial study, fail to change long-term behavior. We must combine technology with culture. The implications for nursing are clear. We should move away from ineffective email reminders and towards high engagement virtual reality training. Policy-wise, healthcare leaders must be held accountable for social modeling as their behavior sets the standard for the entire unit. We need multimodal strategies that combine active monitoring with a supportive unit culture. In conclusion, the literature shows that while technology is a powerful tool, it cannot work in a vacuum. Effective hand hygiene requires a blend of immersive training, active feedback, and strong leadership. It is recommended to replace passive audits with virtual reality annual competencies, as well as foster a lead by example culture among senior nursing staff. Future research or studies are needed on long-term retention, 6 months or more, of hygiene skills. But by implementing these evidence-based practices, we can significantly reduce HAIs and improve patient outcomes. Thank you.